All right, so it's just some of the voices that we've heard so far from the medical fraternity on why they're shying away from the shot just yet. Let's break it open to our experts this evening and get their perspective. We've got Dr. Rachna Kucheria back with us on NDTV. Good to have you. We've got Hemant Deshmukh, doctor there, Dean at KEM Hospital. Thanks for joining us there. And Aman Gupta as well. He's the managing partner and co-founder for PAG India Healthcare Communication Firm. So interesting to get his perspective on what's going right, wrong when it comes to this vaccine hesitancy at the moment. Dr. Kucheria, to you first. I'm sure there is one conversation that is driving across all meetings these days, and it is about the vaccine, isn't it? Even in your fraternity, what are some of the reasons you are listening into why people are not very confident about taking the shot?
So thank you for having me, first of all. And I would like to answer your question perhaps in two parts, and I can do it one now and one when you come back. As a public health physician, I will answer generically that vaccine hesitancy, as you know, is a known phenomena for obviously decades. And it is well known in the literature that the mere sharing of information may not do away with vaccine hesitancy. People have to have confidence in the healthcare system, in the system at large, for them to overcome this hesitancy. Now, remember, with the COVID, with the coronavirus disease, you have the whole spectrum from mild to quite severe and hospitalization. And people have learned through these past 10 months that most people get a mild form and very few actually end up getting hospitalized. So I feel that, that may also be playing into their choice-making ability, which one should they choose. The third aspect is full disclosure. For any treatment, be it treatment, medicine, or a vaccine, full disclosure is required. And this is the hard part. It's a hard part world over. We don't know so many things about the disease itself. So obviously there are gaps in vaccine information as well. But I think even that should be shared. That what are the blind spots? We know that it's preventing severe infection, but what about the inflammation? What about asymptomatic transmission? What about asymptomatic and still getting the inflammatory response? What all is the vaccine preventing? And what should they not be looking forward to? I think the more disclosure there is, people's confidence will go up. And that is what you're looking at. That's the opposite of vaccine hesitancy. So I think perhaps not just selecting the information that we think will calm people or not raise panic, but perhaps trusting the public, engaging groups of people, whether it's the ASHA workers or nurses union or the frontline people, engaging them and actually having discussions and conversations where difficult questions are allowed, and we actually allow ourselves to say, look, this is not known yet, but here are the benefits. And then giving people that real choice to come and take the vaccine.
Well, this is something the government is actually attempting to do now. They've actually, if you've noticed, even if you call someone, you don't hear Amitabh Bachchan's voice telling you to stay safe anymore. You hear a lady telling you now on so forth that, the vaccination is safe, go ahead and get your shot whenever your turn comes. So the government is trying communication at various ends, but we don't really know what's going wrong at the moment. Let me bring in Dr. Hemant Deshmukh at this point. Dr. Deshmukh, we actually have now reports from a couple of states where the vaccine shots are going waste. This is going to be, if not curtailed at the moment, this could be a huge problem for a country like India. And what's even more worrying is that this is not normal people that we're talking about. These are informed healthcare workers who are refusing to take the shot. I want to understand from you some of the reasons why you think people are hesitating.
The very fact that you said people are hesitant to take, it simply means that there is a lot of hesitancy amongst the healthcare workers, and they are going to set an example to the other frontline workers and the citizens of India in general. So my take on this would be very simple, that one should break the chain of transmission of this virus. So when I say they break the chain of transmission of virus, I mean that you get immunized, you get a milder disease, if at all you get infected, you are going to get infected anyway. So the disease will manifest in a very mild form, not in a very serious, not in a very critical form. And hence the vaccination is very important to save us from a very critical condition of COVID-19. If you take the vaccine, there will be a group of population, a large group of population who is going to be away from COVID infection. And this in fact is going to break the chain of transmission. Mind you that if anyone gets a mild infection, the transmissibility will definitely decrease. The rate of infection would definitely decrease.
Doc, we
and
understand all that, but why do you think this information is not percolating down maybe, and why is it that health workers are missing their spot and not going to get their shot as well? Let me bring in Aman at this point. Aman, you are somebody who deals with communication and healthcare communication to be particular. This is, really a very, very sort of strong time for that to happen. What do you think is lagging, or let me put it this way, what do you think India needs at this point to ensure that all these comments that come forth when it comes to hesitancy are met with? The government says they have a full PR exercise in mind. There'll be banners and posters everywhere. You'll be hearing this woman on the phone all the time. Do you think it's going to work, or are we all waiting for that one shot of the Prime Minister getting the vaccine, and only then will we have a reinforced idea that all is well?
Well, I think, of course, if that do happen, that will be a kind of a tipping point for people to go for vaccine. But I think if you just look at it from vaccine hesitancy perspective and the role of communication, what we are seeing right now is kind of a one-way communication from the government. So you pick up your phone, you hear the fact that you need to go and vaccines done. But we also know that people have a lot of questions. They have a lot of apprehensions. And as Dr. Rashmi started with, it's not something which is
Rachna.
a recent phenomenon. It's been there for a long period of time. It's something which we have seen happening with other vaccine. So there is a need for us to communicate in a more two-way way, in a kind of a two-way side where people can ask questions, they can get their queries answered. And I think till the time that doesn't happen, there will be a certain hesitancy which will remain. Besides that, I think the use of the mass media, social mobilization, as well as training of the health workers, the people who are engaged in giving the vaccine, apart from the one who are taking, and giving them, because they are the ones who will lead the way here. And sort of percolate the message to the larger population.
This administration, Modi government, knows how to make use of social media. It's one of their biggest strengths. We've seen that in election after election. And when you say engage social media, that's already happening. It's still not working on the ground.
Well, I think if you just look at the scale of the problem and how much time has gone in making it happen, right? So the whole vaccine campaign has just started. I think it's too early for us to sort of say that it's not working. It will take its little time to start, giving the results. And I think everything right now is happening almost on an overdrive. Getting a vaccine out in 10 months from the time when the COVID sort of came out for something which takes 10 years. I think we need to give a little bit more time. Yes, we do need to add more layers to it. But I'm pretty much sure that, over a period of time, it will have its impact.
Let me bring in Dr. Sarkar at this point. Dr. Sarkar, today also the government announced that the Prime Minister will be getting the shot very soon, and that's going to happen in the second phase. We don't know when that's going to happen, but that's also said to be one of those encouragement exercises to sort of build more confidence in the people. But, we also know that some states are actually doing better than the others when it comes to meeting their vaccination targets. And I don't want to jump to a conclusion at this point, but do you think there is still a lot of question and a lot of hesitancy when it comes to Covaxin, and that's the reason why they're still being made to sign those forms, which is not the case, say, with Covishield? Dr. Sarkar?
Sonal, I'm sorry, your voice cracked a little bit. I'll just focus a couple of comments on one thing, which is the incidence of vaccine hesitancy. You see, the incidence of vaccine hesitancy in the country has got a lot to do with at what phase of the epidemic vaccination is being introduced. Now, India is a tremendously lucky country in a way that we've got the luxury of vaccination being introduced at the falling phase of the pandemic. Now, this fortune has not gone on to United Kingdom, United States, or to anywhere. And there is a kind of feel-good factor in people so far. They think that the worst of COVID is behind us because from the heady days of mid-September of 1 lakh plus, we are now down to the 10,000, 12,000 cases per day level. So this is one thing which is giving us, I fear, where is it a false sense of confidence? It should not be, but I think this is very prevalent among people because we are the only major country in the world who's getting an opportunity to vaccinate at the declining phase of the pandemic. The second factor, why the hesitancy is quite well noticed in the medical fraternity is the fact that the science of the vaccines has been played out in public. And there have been instances like the couple of faux pas with Covishield and their statistical presentation, with Covaxin getting a premature kind of nod by the government. Because a few years ago, you would not have the general people or even the general medical fraternity being privy to all this kind of information, which thanks to people like yourselves, we have today at hand. So far too much, there is a little bit of information toxicity at this point of time.
Well, I have to wrap at this point, but this is a very interesting conversation. Very interesting what Dr. Sarkar is saying. At one point, we're all asking for more information. Even as journalists, we're wanting to know more about what's going on in the vaccine process, right from the procurement to how does it work, etc. It's been a fascinating sort of topic at that point. I have to slip into a very quick break. Be back in a moment with more. Stay tuned.